Welcome to Adapting Class. Vasodilators are very important cardiovascular pharmacology that you need to know. They are part of the cardiovascular system. They are medications that are usually shows up in multiple exams because a lot of people take it, and there's a lot of uh, opportunity to make mistakes. So because of that, your board will ask you, okay, teaching, education, and pure pharmacology. So stick around and let me give you very brief information that is memorable. You will never forget after watching this video. As usual, I am a pathophysiology guy, so I'm going to give you some pathophysiological aspect of it. This is what I believe. Vasodilators are not the right name for this. When we say something is a vasodilator, that means it deals with both the artery and the vein. But these medications, they don't deal with the arteries in the vein. They are basically venodilators. I call them venodilators. How do they do this? They relaxes the smooth muscles. The smooth muscles in the vessels, they relax them. They relax them to the point that basically allow these muscles to relaxed and such that they make the veins so relax the muscles and allow them to basically increase, I would say they dilate. In the process of dilating, they increase their capacitance. That means they can hold a lot, right? Capacitance, right? They increase their capacitance such that they may be able to hold a lot of blood. In the process, they keep blood in the periphery. In the process, they relaxes any pressure the heart is going to pump against. So what am I trying to tell you? These are their functions. These are specific things will happen. If I'm going to relax the vessel and I'm making it really big, this is the example. This is the vessel. Okay. This is the vessel wall. If I relaxes it, I make this vessel really big. So it can carry a lot of blood in it. In the process, what do you think is going to happen? If there's a blood in your head, you get headache, generalized side effect. If it's in your face, you get flushing, generalized side effect. If it is in your legs, you get edema, generalized symptoms. If it's in your leg or your face get warm, common side effect, right? If all the blood is kept in the periphery, what is going to happen? You become hypotensive. And this hypertension is orthostatic. And then you become what happened? You feel easy. You don't have to memorize this concept. It's based on pathophysiology. And so this is what happened to them. If they keeping all the blood in the periphery, they're going to decrease something we call preload. That's blood going back to the heart. They also relaxes the pressure the heart is going to pump against. So preload and afterload decreases. This is the pathophysiology of this problem. And everything about nitrate, all the side effect is related to this. Okay, so I'm going to take it one at a time and then I'll show you what you need to know about them. What do I mean by that? There is different kind of nitrate, right? You have to know them by name so that when you see them, we have hydralazine. Okay, we have isosorbide. This comes in two. There is a mono or dinitrate. So if you see it, don't worry. So far as you see isosorbide, it's the same thing. There is a Milrinone, right? This is specialized. It's a very important one. And of course, everybody know about nitroglycerin. You should not just know that because there's other nitrates you should be familiar with. So I'm going to take one by one and show you what you need to know about each of them. The most common one is nitrate, nitroglycerin. That's what everybody know. And sometimes they use NGT, right? It comes in different form. It comes in IV form. You can have IV form. It can in patch form. You can have sublingual, right? So you can have sublingual form also. So that's why you have to know all forms of nitro depending on the way. But IV, patch, and sublingual is the way it comes in. Each of them has a specific function, right? And the most common use for it is for, especially if the sublingual. So let me give you the sublingual. This is used for acute angina, so acute chest pain, right? What are they teaching? You teach the patient, sit down before taking it. So because you can get dizzy, you can lay down, it's fine. You put it under the tongue, it's sublingual, right? Under the tongue. At first dose or first sign of what? Chest pain. You don't take it continuously at first sign of chest pain. If no resolution after the first dose, call the doctor. So call 911. 911, not the doctor, 911. Then take additional 2 tabs for a maximum of 3 doses in a total of 15 minutes. That means 5 minutes each. So you take the first one, okay? You take the first one, and if you still have pain after 5 minutes, you take the second one. But before you take the second one, you got to call it 911 and take the second one, wait another 5 minutes, and take it. It's very, very important that you teach the patient as much as possible. What other teaching about the sublingual? Keep in original container. Avoid light as much as possible. And the patient is going to need 6 months supply. 6 months. So everybody gets 6 months supply. Remember that 6 months supply is what you're going to get for these medications. The side effect is the same, right? Hypotension, because it's the same hypotension we talk about. So you're going to have hypotension. That is the most common side effect. You can have dizziness, you can have flushing, you can have edema. They are all the same, right? The common one is headache. And I'll talk about what you need to do for each of them. So this is for nitroglycerin, specifically for that, and some of the things you should know. Remember, biggest interaction associated with this is taking interaction. Basically, let me put it here because they will ask you about this. Sildenafil. These are uh, used for impotency, right? Erectile dysfunction. Another one is tadalafil. They causes vasodilation, the same vasodilation. So when you take it, you're going to have a problem. So any patient taking one of those is a contraindication, and you have to intervene. You have to you have to see this patient, teach them, intervene. Otherwise, they're going to have a heart attack while taking it. Okay, it's very, very important. So that's the first one. The second one, another medication, let me use this. Another medication will be isosorbide, isosorbide mononitrate. It does not have too much specific things associated with it. So just know that it can be used in heart failure. That's the most common. It can also be used in angina. And it come in this sustained released. This is the only one that come in sustained release. And therefore, when you're teaching the patient, you know, right? No crashing, no chewing, right? You take it as a whole, right? That is the key. Isosorbide mononitrate is one of the nitrates you cannot it come in a sustained release, extended release. So because of that, you can do the things you do with normal medication. The next one, I think, is this hydralazine. Here's some specific side effect. If you see questions, you should be able to answer it based on this video. It can be used in hypertension emergency. You can use it or heart failure. The problem is this: it causes reflex tachycardia. So your heart rate goes up. It also causes urinary fluid retention, right? It causes fluid retention. Because of that, when patient is taking this medication, hydralazine, you need to give them beta blocker. So they have to take it with a beta blocker to prevent the tachycardia, and you have to give them diuretics to prevent the urinary retention. That is key regarding hydralazine. There's another thing it causes that you have to know. The patient can have lupus-like symptoms. It will look like they have lupus, like butterfly rash in their face. So like a little bit of photosensitivity. These are classic for hydralazine. Reflex tachycardia, fluid retention. Because of reflex tachycardia, they need to have a take beta blocker in addition to diuretic to prevent fluid retention. The next medication is Nitroprusside. This is also you need to know because it's a testable question. Nitroprusside. This is also nitrate. It can be used for hypertensive emergencies. So if you have a patient with blood pressure is like 250 or 120, best medication to choose is Nitroprusside. What is the biggest side effect? It can cause cyanide toxicity if you use it for maybe more than 3 days, right? Because of that, you should monitor for cyanide toxicity, and which comes as confusion. They can get weakness, and then they will have seizures. If you're happy, you use tiosulfate to treat the nitroprusside associated cyanide toxicity. So those are key. These are testable information you need to know when you're taking this medication. You should watch for this side effect about it. The last group type of medication that I wanted to know is Milrinone. I'll put it here like that because it's very interesting. Just to have an idea. This is the only form that can in that is only can be given in IV form. It can only be given in IV form. There is no other form, and it's used for patient who has decompensated. That means your heart is basically gone. Decompensated heart failure, or you have acute heart failure. You never had heart failure before, and you're going to die from it. This is where we can use it. You can also use it as a bridge to transplant. If you want to transplant it, this is what we use. Like I said, because he's only giving IV, patient needed two large bowl IV, right? It causes a lot of urine output, right? Increase urine output. Because of that, you need Foley. Don't forget it. They need Foley. It causes arrhythmia. This causes arrhythmia. So you need to monitor, they need cardiac monitor. Okay. Very important. Something to monitor the heart rate and everything. You can only be giving only 72 hours. If more than 72 hours, it causes problem. There's some parameters you got to check while you're taking this medication. If the blood pressure systolic blood pressure is less than 90, you got to stop it. Or if the blood pressure drop 20 to 30 points, you have to stop the medication. So those are key aspects that I want you to know regarding this medication. And that is what is used. And it's used for short term. This is not for long term. Like I told you, it's just a bridge. Before I finished, so these are the group of medication. There's some few teaching for your NCLEX that you have to know. I'll clean this. There's few teaching that you have to know regarding nitroglycerin. It comes in patch. So nitroglycerin will come in patch. And then you have to teach the patient how to take care of it. We use the patch for chronic angina, not for acute. That's why if the patient has a patch on and they started having chest pain, you should let them take the acute form, which is sublingual. This is a testable key concept. A patient with a patch is used for chronic angina, not for acute angina. So if they have chest pain, they can take additional acute medication, which is sublingual, but keep the patch on. Don't take the patch. Okay. It provides steady release of nitrate, but it doesn't deal with acute problem. The teaching you provide the patient is what? One patch at a time. So one at a time. Second, it has to be clean area. The area has to be dry. It should be airless. There should be no cut, no bruises, as much as possible, away from bone, right? So you can put it on your chest, you can put it on your back, you can put it on your hip, but away from bone as much as possible. Okay, you can put it in your upper arm, is fine. So those are the things. They should rotate sides. Okay, there should be no shaving because if you shave, you cut the area. This is key. What else do you teach them? Right? Don't manipulate. So don't cut the patch. Don't cut the patch. Just use it the way it is. Don't cut the patch at all. So they shouldn't cut the patch. They should not modify it at all. And to remove it, wear gloves, fold the patch together, and dispose it. Then you wash your hands. Okay, that's the most important way to keep it. How long do you keep the patch on? One, you can take shower with it. So don't say I have a patch on, I'm not taking shower. They can take shower with the patch. The next one you have to teach them is in order to prevent tolerance to the medication, you keep in 12 to 14 hours, then you take it off. So the off day prevent tolerance. It's very, very important. And keep it in the original container, whatever they give you with it, you got to keep it like that. So those are the things you can teach the individual about this as much as possible. So this patch information, sometimes people ask all the time, I'm giving you all the information they likely going to ask you regarding. You also need 6 months supply. Okay. It's very, very important to know about it. This is the information about the patch that you're supposed to know regarding that is for chronic. So if you have pain when you're taking it, you should take a sublingual one. The last few information is this, NCLEX favorite, right? So for all of them, what is the general nursing care? What are you going to do when you're caring for this patient? You should monitor for blood pressure and heart rate. Remember, they can have reflex, and then assess for orthostatic. Okay, so you tell them to rise slowly, otherwise you're going to fall. Right? Then you check for headaches. They should not stop taking it because if you have headaches, that means the medication is working. You should take like acetaminophen, so like analgesic to help with the headache. You should avoid alcohol. Alcohol is always bad because it can cause more hypotension. Right. So those are the things these are the key nursing facts you need to know. Before I finish, NCLEX tips. This is what NCLEX will give you. Watch for what do you do with hypotension? Patient is taking this medication as hypotension. Most of the time, they're getting it through IV form. And therefore, what do? You stop the medication, elevate the leg, and then call the ACP. If it's Milrinone, this one, because it's used for decompensated heart failure, yeah, what it does is it has a very important function. It's ionotropic. So it causes contractility, improve contractility at the same time, decrease preload and afterload. So it's like digoxin. Because of that, you cannot just stop it. You can decrease the rate and then call the doctor. Okay, they may ask you the next information you need to know is what do you do? What do you teach the patient about the sublingual, which is the most common question you will see in NCLEX. Once again, you take first dose with onset of chest pain. After that, if you still have pain 5 minutes later, call 911. Take additional 2 tabs. Okay, 15 minutes each. Take additional 2 tabs. No, 5 minutes each for a total of or for a maximum of 3 doses within 15 minutes. This is NCLEX Vasodilators. What I've teach you, if you watch it and you take note and you pay attention, there's no question regarding this medication they're not going to ask you. I've given you everything. I hope you learned something. Thank you for watching. Take care of yourself. If you like it, you can share the video or subscribe to Adapt NCLEX for more content like that. Take care of yourself and good luck in your exams.